At Blind Veterans UK, we provide lifelong support to veterans who have lost their sight at whatever stage of their lives. Many of our beneficiaries are in their 70s and 80s. When COVID-19 hit, we found that suddenly we could no longer provide our usual face-to-face care at our centres in Brighton and Llandudno and in the community. As we switched to home working, we initially focused on the veterans' basic, essential needs, such as food and medication. But we knew that they would quickly become isolated, lonely, and deconditioned, all of which could damage their emotional and physical well-being. We surveyed our veterans to see where the demand was and quickly realised we needed to adapt the way we worked to reach a vision-impaired, often elderly group in a remote environment. This meant tailoring our methods to different levels of technology because of the equipment veterans had or their ability to use it. For some, we were able to use group and one-to-one sessions on Microsoft Teams. For others, the telephone, either direct or through the Teams app. We also created postable assets, both audible and printed, for those unable to use anything else. We developed 3 elements to our program: physical well-being, emotional well-being, and creative, but there were significant crossovers and joint working between these. In physical well-being, we focused on the key areas of physical deconditioning, sleep hygiene, falls prevention strategies including strength and balance exercises, and diet and nutrition advice. We ran weekly exercise groups over Microsoft Teams, ranging from low-impact chair-based exercises through to HIIT sessions. We also prescribed bespoke exercise programs for our veterans where specific health conditions need to be considered, motivating them to keep active and maintain a good level of physical health. Emotional well-being interventions use the 5 ways to well-being model. This is built around the elements of connecting, being active, keeping learning, taking notice, and giving, and how these empowered our veterans to make positive changes and lead a more fulfilled life. We offered a series of 5 weekly sessions and a follow-up pack which maintained and improved their well-being and resilience. These sessions also allowed any concerns to be referred to GPs or gateway services. Our final strand was around creativity. Much of this was built around collaboration. Veterans were sent project packs of their choice, including art, craft, gardening, and written word projects, and took part in virtual chat groups. We also set up hobby circles where veterans meet virtually every month in groups from knitting to wood turning, photography to gardening. And finally, we are building our creative book, a book and online resource for our veterans, staff and volunteers to capture this moment in history through creative contributions. When we started, we worried that the change to remote rehab would be too much for our veterans and maybe for our staff, but we successfully overcame many obstacles. Dual sensory loss was not as much of an issue as we feared and overcome through smaller groups or one-to-one sessions. A lot of the work which made the program a success was in the preparation. We were used to ensuring all our delivery was VI appropriate. We just had to learn how to transfer that to the virtual environment. We carried out full assessments before launching any new programs and used these along with pilots and shadowing to build staff confidence and peer support for veterans accessing sessions. We also set out clear ground rules to allow equal participation and full engagement from all taking part. Our results have been better than we could have hoped. Working remotely means we are reaching more of our veterans than ever. Veterans report feeling comfortable receiving support in their own homes, and there is less need for them to make difficult journeys to see us. They can also connect with others sharing the same interests, wherever they are in the country, easing the process of making friends and getting peer support. It has many advantages for the charity too, being much more efficient in the use of our resources. As the country opens back up, we will be reopening our face-to-face services alongside our virtual ones, but the last year has shown us how we can deliver an efficient and effective service to our beneficiaries remotely, and this will be a significant part of our service delivery in the future.